in this session we are discussing about the development of face. Okay, we'll start from the development of third week. So during the third week we can see the development of 3 germ layers in your embryo. So if we have a look from the above, this is how exactly it will look. So this is your ectoderm and this is your cranial end and this is the caudal end. Between these two we have a tube-like structure that is called neural tube. Okay, this is called neural tube. So if I take a section of this figure in a midline, just like this is how the structure will look. Okay, this is your cranial end, this is your Sure. Thank you. Okay. So this is ectoderm and this is cranial and caudal end. Between the cranial and caudal end we have neural tube. Okay. So now we are taking this section at the midline point and this is how the structure will look. So this is your cranial end, this is your caudal end and this part is your intraembryonic mesoderm. In the intraembryonic mesoderm we have neural tube. Okay. So in the cranial end we can see the development of which part? Development of your heart. Okay, and this region where your mesoderm is absent, it will call as buccopharyngeal membrane. Buccopharyngeal membrane, and this part is called as cloacal membrane. So these events are taking place in the third week. Okay. Once the development of your heart starts, this structure will go under a process called folding. So in this class we are only concentrating on the cranial folding or head folding. Stop talking. Cranial or head folding. Okay. So now once the folding takes place, this is how the structure will look. Okay. Once the folding takes place, we can see the bulgings. There will be 2 important bulgings at this phase, and this event will happen in the 4th week. Okay. So this bulging, the second one will give rise to your pericardial region or cavity, where we can see the development of heart. Next, this is your foregut and this part is your brain vesicles. These brain vesicles are developed from which part? These brain vesicles are developed from your neural tube part. Okay. So once the brain vesicle development start taking place, the brain vesicle will bend towards the anterior aspect or towards the front region. So once the bending takes place, this region will bulge more like this. Okay, and this particular bulging is nothing but the mesoderm bulging. This is your mesoderm bulging, which is also known as, what it is also known as, what process? Frontonasal process. This is known as frontonasal process. From this process, your face is going to develop. Okay, any doubts in this? Any doubts? No doubts? Okay, fine. So after this, once the frontonasal process takes place, we will see only the formation of your face region. Okay, to check that, I will draw only the frontonasal process part like this. Okay, so when the development of your face is taking part, in the neck region we can see the development of pharyngeal arches also. So here we can see the presence of your first pharyngeal arch. Below that we have pericardial region. This is your first pharyngeal arch, which is also known as mandibular arch. So what are all the derivatives of first pharyngeal arch? What muscle will derive from your first pharyngeal arch? Muscles of mastication nerve, mandibular nerve, and it is supplied by, muscles are supplied by which artery? Maxillary artery, similar to your aortic arches, first aortic arch. Okay. So here we can see two important processes, those are deriving from your mandibular arch. What are those? It is maxillary process and mandibular process. Okay, these are the two important processes that derive from your first pharyngeal arch. Any doubts in this? So once your first pharyngeal arch divide into your maxillary and mandibular process, your frontonasal process will also get increased in the size and it will move in a downward direction like this. Stop talking. So this is your maxillary process and this is your mandibular process and this is your frontonasal process. Once the division of your maxillary and mandibular process takes place, this your mandibular process will start moving towards the midline structure and also your frontonasal process. So they will be joining in this area and also in this area. So once they fuse with each other, this is how the structure will look. Stop talking, everyone. So this is how your mandibular process will join and fuse with each other to form lower lip and also lower jaw region. Okay. Now in the frontonasal process, we can see two important thickening takes place. It is thickening of your mesoderm. Okay. The first thickening takes place at the medial part and the second thickening takes place at the lateral part. The medial thickening is called, what it is called? It is called nasal placode, and this lateral thickening is called lens placode. Okay. Any doubts in this? Any doubts? So once your first pharyngeal arch give rise to the maxillar process and mandibular process, your frontonasal process will start increasing in the size and it will move in the downward direction. After that, both your frontonasal process and your mandibular process will start moving towards the midline and fuse with each other. That is, the right and left structure will fuse with each other. So here we can see the structure of mandibular process, which is going to give rise for your lower lip and also your lower jaw region. And here in the nasofrontal process, we can see two important thickenings, one in the medial side, one in the medial part, that is called nasal placode, and other on the lateral side, that is called lens placode. Okay. So once the nasal placode appears or forms, it will immediately give rise to one more structure called nasal pit. Okay, like this. Nasal pit, and this nasal pit will open into your stomodium part. This is called stomodium, which is your future oral cavity part. Okay. So now this is called nasal pit. Okay. Once the nasal pit formation takes place, there will be differentiation in your mesoderm region around the nasal pit. This is how the structure will look. Okay, these structures are very important. This part is called medial nasal process and this part is called lateral nasal process. Okay, these are the few important structures. Any doubts in this diagram? Any doubts? No doubts? Okay. So now your nasal pit will start moving towards the stomodium region. At the same time, your maxillary process will also start moving towards the mid region like this. It will start moving towards this region and it will fuse with one another. All these structures are going to fuse with one another. When this event is taking place, your lens placode will go from lateral to medial sides. It will come here. Okay. Any doubts in this? Any doubts? Okay. So next we will see what happens once all these structures fuse with one another. Okay. So your frontonasal process will give rise to your forehead and nose region. Maxillary process will give rise to your upper lip and upper jaw region, including your cheeks, and the mandible region will give rise to lower lip, lower jaw and also your lower cheek regions. Okay, I will explain with diagram. Now you see for the next picture. Next, once the fusion takes place, this is how the structure of your face will look in the embryo. Stop talking. Okay. So now see here, this is your mandibular process. Okay. Mandibular process is going to give rise for your lower lip, jaw and also cheek regions. And this is your maxillary process. Now your maxillary process and this is your lens placode. Okay. It have a small cavity between those two structures, this cavity, this area. Okay. This area is particularly called, what it is called? It is called Naso-Orbital Furrow. It is called Naso-Orbit Furrow. Okay. Remember these 4 points. Your Naso-Orbit Furrow or orbital furrow is nothing but an ectoderm filling. Okay. It is your ectoderm filling. So during the process of development, your ectoderm filling will go under a condition or a process called canalization. Once the canalization of this ectodermal filling takes place, it will form an important duct. It is called nasolacrimal duct. Nasolacrimal duct. Okay. And the cranial most part of this nasolacrimal duct, that means this point, this is called lacrimal sac. It is called lacrimal sac. Okay. These points again you will learn in your development of eye and also in the gross structures. But remember, there will be a cavity or a gap between your lens placode and between the maxillary process, and that gap is called naso-orbital furrow. During the development, the ectodermal filling of the naso-orbital furrow will undergo a process called canalization. So once the canalization takes place, it will lead to the development of your nasolacrimal duct. The cranial most part of the nasolacrimal duct, that is this point on both sides, it is called lacrimal sac. Okay, this is some important point you should remember. This is important for your clinical problems. Okay. Next we have maxillary process. Other than that, we have, what is this? Nasofrontal. This is your nasofrontal process. Okay, and this is your medial nasal process, and this is your lateral nasal process. Okay, the medial nasal process will give rise to tip of the nose region, and the lateral nasal process will give rise to which part? Ala of the nose. Ala of nose. Okay, and this region in the upper lip cavity is called philtrum. It is called philtrum. Okay, these are the few important topics you should remember. This is your mandibular process, this is your maxillary process, and this part is your nasofrontal process. Next to the nasofrontal process, we have medial nasal process that give rise to tip of the nose, and this is your lateral nasal process that gives rise to ala of the nose, and this part in the region of your upper lip and nose, between the upper lip and nose, it is called philtrum. Okay, these are the derivatives of the intraembryonic mesoderm. Stop talking. Medial nasal process will give rise to tip of the nose. Lateral nasal process will give rise to ala of the nose. Okay, this is all about the development of nose. You can draw the first two diagrams and this last diagrams. If you get a question for the development of face, you have to draw the first two diagrams which I have drawn and the last one. Okay, any doubts? Any doubts in this? Any doubts? Okay. So during the 4th week of development, after the formation of the head fold, two prominent bulgings appear on the ventral aspect of the developing embryo. Those are separated by stomodium. These bulgings are nothing but the developing of your brain part and also the pericardium region. So the floor of the stomodium is formed by the buccopharyngeal membrane, which separates it from the foregut region. On each side, the stomodium is formed by your first pharyngeal arch. So soon after that, your mesoderm will cover the developing forebrain, proliferates and forms a downward projection that overlaps the upper part of the stomodium structure. This downward projection is nothing but the frontonasal process. Okay. The pharyngeal arches are laid down in the lateral and ventral walls of the most cranial part of the foregut. These are also therefore in very close relationship to the stomodium structures. Your pharyngeal arch is present very close to your stomodium and it is related to your stomodium part also. But mainly you have to concentrate on the frontonasal process, maxillary process and mandibular process. You can see here, this is your buccopharyngeal membrane region and this pit-like structure is nothing but the stomodium, which is later going to develop as a oral cavity, and your buccopharyngeal membrane is going to develop as a mouth region. Next to that we have foregut. This second bulging is going to develop as give a site for the development of your heart, and this bulging is formed by your brain vesicles enlargement. Okay, this is nothing but the mesoderm core, which is known as frontonasal process. You can see here, this is how the bulging of your frontonasal process looks in the embryo. Okay. Next, the development of face is mainly formed by 5 swelling or process, that is single frontonasal process, paired maxillary and mandibular process. The 5 facial primordia consist mainly of mesenchyme, that is derived from the neural crust cells, and it is covered by an ectoderm. The very first picture which I have drawn the ectoderm. There I have shown cranial and caudal end. Between the cranial and caudal end we have a neural tube. Okay, in the neural tube region we have neural crust cells also, and those cells are mainly formed by the mesenchyme core. Each mandibular arch, that is your first pharyngeal arch, forms the lateral wall of the stomodium. This arch gives off a bud from its dorsal end. This bud is called maxillary process. It grows ventromedially cranial to the main part of the arch, which is called as mandibular process. So your first pharyngeal arch will divide into maxillary process and mandibular process during the 4th week of intraembryonic life. The ectoderm overlaying the frontonasal process soon shows a bilateral localized thickenings. I have talked about 2 thickenings of mesoderm, one in the medial region, that is called, what it is called? It is called nasal placode, and another one on the lateral thickening, that is called lens placode. Okay. So these are called the nasal placodes. The formation of these placodes is induced by the underlying forebrain development. The placodes soon sink below the surface to form a nasal pits. This is the nasal pit which I have talked already, and these pits are continuous with the stomodium below. You can see here, once the nasal placode formation takes place, it will lead to a formation of nasal pits, okay, and below that it is entering into your stomodium region. The edges of each pit are raised above the surface. The medial raised edge is called medial nasal process, and the lateral edge is called the lateral nasal process. So surrounding your nasal pit, we can see two important processes. The medial side one is called medial nasal process, and the lateral side one is called lateral nasal process. Lateral and cranial to the nasal placodes, a pair of one more thickening will appear, that is called lens placodes. Yes, you can see here. This is the frontonasal process. First there is only first pharyngeal arch, that is mandibular arch. Later your mandibular arch is going to divide as a maxillary process and mandibular process. When this maxillary and mandibular process are getting separated, your frontonasal process will increase in size and it will start moving towards the downward direction. Next, once the mandibular process joins with one another, that is they join with each other, we can see the thickenings. One is nasal placode and another one is lens placode. Okay. Next we can see the navel which is opening into your stomodium region, and surrounding the nasal pit we have medial nasal process and lateral nasal process. Any doubts in this diagram? So next, the development of various parts of your face region. The nasal pits grow deeper to form the nasal cavities, and the medial nasal process thins out gradually to form the primitive nasal septum. The globular process of medial nasal process fuse to form the philtrum of the upper lip. So what is globular process of medial nasal process? Take a assignment question. It's very easy. Write down what is globular process. Okay. Your globular process will give rise to the philtrum of the upper lip. Philtrum is nothing but the area that present between your nose and the upper lip region. Okay. Next, the two maxillary process grow medially below the developing eyes and fuse with the lateral nasal process to form the lateral part of the upper lip and upper part of the cheek region. The two mandibular process form the lower lip and lower part of the cheek region and also your lower jaw. The surface opening of the stomodium will lead to the development of oral cavity, and lateral angles of the oral fissure, that is your oral cavity, are formed by the fusion of your maxillary and mandibular process. Any doubts in these points? So your mandibular process is going to develop as which part? Mandibular process is going to develop as which part? Get a both of you. You both. Yeah. Next to you. Yeah. Get a mandibular process will give rise to which part? Or anything you know, you can answer. Mandibular or maxillary or frontonasal? What are the structures we can see in the development of face? Stop talking. What are the structures we can see in the development of face? Okay. So your eyes are developed from which part or which process? Lips are developed from which process? Say it again. What process? Globular process. Okay, what is globular process? Where you can find the globular process? Next, what structure you can see in your face? Okay. So your mandibular process give rise to your lower lip, lower cheek and also lower jaw region. Your maxillary process will give rise to upper lip, upper cheek region and also part of the philtrum, that is the area present between your nose and upper lip and also the upper jaw region. And your frontonasal process will give rise to your forehead and nose region. Okay. You have to remember which part the medial nasal process and lateral nasal process will give rise to. Any doubts in this? Okay. So you can see here, this is the naso-optic furrow, this one, this structure. Okay. It is nothing but a gap or a cavity present between your lens placode and which part? Maxillary process. So here you can see the maxillary process fused with your lateral nasal process in this region. Okay. Next, we have a lateral nasal process and your lens placode is going to develop as a eye region. The maxillary process, here it is fusing with your medial nasal process. Remember, your maxillary process fused with both medial and lateral nasal process. And at last we have mandibular process. Okay. So here we can see the maxillary and mandibular process fuse with each other to form the cheek region, so that the mouth part is going to become smaller. Here, see this. This is your nasolacrimal duct, that is formed by the canalization of your naso-optic furrow region. And from the naso-lacrimal duct, the cranial most part, this is called lacrimal sac. Okay. Any doubts? Any doubts in this? Okay. You can see the different parts or different derivatives of your face region that is developing during the 4th week. Take a look at diagram for 2 minutes everyone. I'll share the PPT, stop clicking pictures. Any doubts in this? Okay, fine. So next, this is the tabular column for all the components, process and also their ratio compared to the stomodium and the different parts of your face that is going to develop. Okay. Next, we have nerve supply. The whole face is supplied by which nerve? It is supplied by facial nerve. Okay. Trigeminal nerve. Okay, your trigeminal nerve has 3 divisions. The first one is ophthalmic division, the second one is maxillary division and the third one is mandibular division. During the development, you have to remember the trigeminal nerve, which is a 5th nerve that has 3 divisions. Okay, so your ophthalmic division will supply to your frontonasal process, maxillary division of your trigeminal nerve will supply to your maxillary process and mandibular division of the trigeminal nerve will supply to your mandibular process. Okay. Different parts, that is the different derivatives are given here, but remember ophthalmic, frontonasal region, maxillary, maxillary process region, and mandibular nerve, mandibular process region. Okay, this is the 3 important points you should remember. We can see here. The forehead and nose region develop from your frontonasal part, and this maxillary part, that is the upper part of the cheek region, and this is the philtrum. This region is the philtrum region, and this is the lower part of the cheek region and also the lower entire mandible region. The bone is there, no, mandible bone, its attachment, muscles attachment is there, no, that entire region will be supplied by your mandibular nerve. These points will be even discussed in the pharyngeal arch chapters also. Okay. Next we have clinical anatomy. The very important clinical point in the development of face is cleft lip. We have unilateral, bilateral and few other forms also. The cleft lip is commonly occurs in the upper lip region. The incidence of cleft lip happens 1 in 1000 birth, and 60 to 80% of children involved are males here. The cleft upper lip presents 3 varieties, that is unilateral cleft lip, bilateral cleft lip, and the last one is central cleft lip. Okay. So when the unilateral cleft lip takes place, it occurs due to the failure of fusion of your maxillary process with the medial nasal process of the same side. Okay. And bilateral cleft lip occurs due to the failure of the fusion of maxillary process with the frontonasal process. So how your maxillary process is fusing with your frontonasal process? What is the gateway? This is your maxillary process and this is your frontonasal process. What is the gateway between these two to connect with each other? Yeah, it is a Naso-Orbital furrow region. Okay. Next we have central cleft lip. It occurs due to the failure of development of the philtrum of the upper lip region from the frontonasal process. We have the last one, that is the cleft lower lip. Sometimes we can see the cleft happening in the lower lip region also. Very rarely the two mandibular process may fail to fuse in the midline to cause cleft lower lip. The defect usually extends into the jaw region. I said your mandibular process on both the sides should come and meet at the midline point. If it fails to fuse with each other, we can see the cleft lower lip condition, and it will not only happens in your lip region, it will extend up to your jaw region. Okay. So here is the picture, you can identify what is this. All these are pictures of unilateral cleft lip. Okay. Few are happening only in the lip region, few are extending up to your philtrum, few are going up to your nasal cavity or opening. This is also again the unilateral cleft lip picture. This is your bilateral cleft lip. Okay. So what happens with bilateral cleft lip? In the bilateral cleft lip, your maxillary process will fail to connect with the nasolacrimal region, that is with your forehead and nose region part. Okay. So the next condition is, okay, central cleft lip and cleft lower lip. This is the part. Cleft lower lip, you can see here, this is happening in the lower lip part. It is extending up to your lower jaw region. Okay. And this is your central cleft lip, which is happening exactly at the central part of the lip, and it is extending in your philtrum part. Okay. The next one is oblique facial cleft. It is a rare congenital anomaly of the face which occurs when maxillary process fails to fuse with the lateral nasal process. The fissure extends from the medial angle of the eye to the upper lip. Consequently, the nasolacrimal duct is exposed to the exterior part. This anomaly is usually bilateral. What is bilateral means? It will happen on both the sides. In this condition, your maxillary process will fail to fuse with the lateral nasal process. Okay. Here is the picture for your oblique facial cleft. So it is happening from your upper lip region to your eye region, until your eye region. Any doubts? Any doubts in this? Okay. The inadequate fusion of the mandibular and maxillary process with each other may lead to an abnormal wide mouth condition that is called macrostomia. There is one more condition that is called microstomia, that is nothing but the small mouth condition. Lack of fusion may be unilateral. This leads to a formation of lateral facial cleft. Too much of fusion also leads to this particular condition, that is small mouth. Okay. You can see here, this is microstomia and this is this is macrostomia and this is microstomia. Yes. That's all about the development of face. In the afternoon session, we will be studying about the development of palate. In your timetable, it is given development of thyroid gland. I will take that in the next session. We will discuss first about the development of palate. Okay. Any doubts in this? Okay.